Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Okay, doctor, one of the things I want to talk about today is really the rampant chronic self-minimization, professional minimization that I see in my profession of chiropractic. And I have a program called the Smart Injury Doctors Program. One of the things we do is we elevate the doctor. We elevate the doctor so that they know exactly where they are in the space of basically taking one of the most significant injuries, one of the most expensive injuries that there is in the market, which is a spinal ligament injury, particularly the non-disc ligament injury that causes spinal instability. And really understanding what role they play, understanding that this is one of the most expensive injuries in the market today. If a person has chronic headaches from this injury, the American Headache Foundation is going to say that they spend about an extra $8,000 to $9,000 per year to medically manage it. The American Pain Society says if it causes chronic low back pain, it's going to cost anywhere from $9,000 to $19,000 to medically manage. The U.S. Pain Foundation says that anybody that has chronic pain, significant chronic pain, is going to spend about $7,000 to $8,000 more per year on medical expenses. So this condition is a very important condition, but nothing shows how important this condition is when you start talking about traumatic brain injuries. The traumatic brain injury is an interesting phenomenon in the fact that there's a lot of emphasis on it. There's a lot of, attorneys are interested in it. The NFL's interested in it. It's like the Wild West of injuries. And so you have these very expensive workups. A traumatic brain injury can cost $20,000, $30,000, $40,000 for the expert just to work it up, right, to look at it. And today, what's interesting about it is the fact that, there's new research out that is basically saying, hey, some of the things we thought about, imaging with the MRI are not what we realize. So, there's a white matter hyperintensities might not be a marker of TBI after all. This is February 19, 2025. Now, here's what I say. What I say is the providers in the market do not fully appreciate, my doctors, my people do not fully appreciate just how significant the upper cervical ligament injury is. The upper cervical ligament injury, just ChatGPT. Just go on ChatGPT and say, hey, can an upper cervical ligament injury damage or cause problems with the cranial nerves? You're going to see 9, 10, 11, 12, the ones that are on the brainstem. Totally. Now, if you say 10, which is the vagus nerve, you're going to go, oh my God, when you look at what it controls and what it does. So in 2016, I wrote a document, and anybody can look it up, is a simple spinal sprain really that simple? And you just look it up with my name. Is a simple spinal sprain really that simple? Jeffrey A. Kronk. And you'll see it, you'll pull it up, Juniper Publishers, you'll pull up it's an opinion paper that I published in an online journal. And not myself, Dr. Brownstein, a number of others. So in that opinion paper, I'm touching in 2016 on the surface of, there was a large study done in Saskatchewan, Canada, where anybody that had a injury, whiplash injury, had twice the amount of headaches long-term, twice the amount of heart conditions, twice the amount of breathing conditions, twice the amount of digestive problems. Twice. Significant, long-term. From this injury. Now, this gets into supportive care. This gets into all kinds of things. But it also gets into the fact that when a patient has an upper cervical ligament injury, the doctors that are treating it need to understand what it is. And they need to be somewhat more expert-like at it. Now, that comes into just understanding what injuries look like in the first place. The majority of the market today does not understand what a spinal injury looks like. So if you basically go, okay, what does a dog bite look like? Everybody gets a picture of a dog bite in their head. What does a burn look like? Everybody gets a picture of a burn in their head. Bad one, not so bad, mild, moderate, severe. What's a gunshot wound look like? Mild, moderate, severe. Everybody gets a picture in their head. What's a spinal injury look like? Nothing, blank. They don't understand what it looks like, yet they're, in some cases, they're treating it, and this is true of almost all of medicine. If you said to medicine, what does a spinal injury look like? They can't tell you, but they're treated. They treat it a lot. They inject it. They medicate it. They physical therapy it. They do all kinds of stuff with it, right? And I'm not saying that there's anything wrong with these people, but what I'm saying is there's a minimization of the condition itself. So if you go to that upper cervical ligament injury and you chat GPT and go, look, can an upper cervical ligament injury cause radicular complaints down the arm of a person? Yeah, 100%. Do you need a disc herniation for that? No. But everybody thinks with disc herniation, oh, I've got a disc herniation. I got to have a herniated disc. No, you don't. No, you don't. Not at all. The non-disc ligament injury will mimic there's basically two symptoms of a disc herniation, pain and radicular complaint. It'll mimic that and a lot more. The non-disc spinal ligament injury causing spinal instability will mimic every single symptom of a traumatic brain injury and more. Now, I'm not talking about, everybody you get nitpicky, all right? I'm not talking about, hey, if I buried you in sand and shot you in the head and your neck didn't move, you have a traumatic brain injury. And if you didn't die, good, you might suffer from that traumatic brain injury for a long time, for the rest of your life, right? And you may not have that that's a traumatic, catastrophic traumatic brain injury. What if you got into a car accident? What if you're saying the whip from the car accident is shearing the connections in the brain? Okay, current theory today, current idea today. We say, hey, we get these hyperintensities on our imaging, on our MRI, and now they're coming out and just look it up. White matter hyperintensities might not be the marker of TBI after all. So there's all this, hey, this is an area of the market that's not really well understood. Well, I'm going to tell you, anybody that understands it completely understands that if you understand the upper cervical ligament injury, you understand how to diagnose it, you understand how to document it, and you know how to treat it, and you will get good results at stabilizing it. Remember, the injuries to the spine are permanent. The injuries to the spine are permanent, but the symptoms don't have to be. Yes, a ligament injury, once it's hyperstretched, it's hyperstretched. You can't put it back, but the effect, the symptom doesn't have to be. The other thing you have to remember is the injuries are the same. The people that have the injuries are all different. And so you have to look at it that way. You have to treat it that way. And somebody that really understands that, here's an example of somebody that understands an upper cervical ligament injury. Okay, so if you have an upper cervical ligament injury, and the upper cervical ligament injury could affect the vagus nerve, and the person comes in, and when they got in the accident, they've suffered for the last 5 years with Crohn's disease. Okay, well, nobody, to my knowledge, except for maybe the doctors that we have in our program, would even think to ask the person, hey, has there been a flare-up in your Crohn's? Now, why are they thinking that? Well, if there's an upper cervical ligament injury that's causing a problem with the vagus nerve, then things could have changed. And now the medication or the procedures or the thing or the diet or whatever they're doing to manage their Crohn's is not working, and it flares. But nobody correlates that to the injury in an auto accident. Okay, long-term studies show these people have twice the amount of problems in these areas. Why is that? Well, it's because the effect that the permanent ligament injury has on the body and the actual injury and where it is. So, I see a lot of doctors minimize. If there was as much attention on the upper cervical ligament injury as there is in the traumatic brain injury space, it appears to me, and I'm not faulting anybody, but it appears almost like this traumatic brain injury space is there to just add claim value instead of trying to figure out, okay, how do I fix people? How do I get them results? How do I reduce their long-term needs? How do I take an injury and I reduce the effect of the injury? And that's all I'm interested in. And because I'm so really good at this, I get paid a lot of money because I know my value in the market. I know my value. I know the majority of doctors do not understand this. I know my value. If I'm a surgeon and I can get great results where other surgeons can't and don't even understand what I'm doing or how I'm doing, like, do I have an issue with money? No, I don't. But if I have an issue with results, then I have to force money. Then I have to rely on schemes or marketing or things like that, which, again, I'm not downplaying. I'm not saying, I'm not trying to be a downer on any of these, but what I am saying is that we have to understand the value of our condition that we treat. The condition that we treat is of very high value. Again, I might look and say, man, the person's in an accident. Good. Hey, you're on high blood pressure medication. Good. Has your blood pressure gone awry? Yeah, it has. Good. What's the cause of that? It's tied right in. It's right there in plain sight. It's tied right in. If you understand what you're looking at and what you're looking for. And the thing that's the beautiful thing with this, if you want to look at something, go to ChatGPT and go, hey, can excessive motion in the spine accelerate spinal degeneration? You have an attorney say, well, where's the research on that? Just ask ChatGPT and have it give you research on it. Hey, can an upper cervical ligament cause problems in the legs? Just research it. Have it give you references on it. Hey, can upper cervical ligament injury cause sexual dysfunction? Go and give me the research on it. Hey, can an upper cervical ligament injury cause breathing difficulties? Let it give you the research on it. I mean, today this stuff's right at your fingertips. It's lightning speed today. And the fortunate thing that I am loving about it is it's going to improve the doctors, and it's going to improve treatments. It's going to get the bad doctors out of the market and get the good doctors to stay relevant and with the actual, in the market, treating as many patients as they can. If you can stabilize spinal instabilities caused by ligament damage, in my chiropractic profession, it's the same thing as saying, can you stabilize the spinal subluxation and get a good result with it? And then manage the person so that the symptoms are very little after the accident. Then you should be the highest paid providers in the market today. You're knocking out one of the main problems with chronicity. Google search, if a person has chronic pain, does their brain shrink long term? Yeah, yes, it does. All right, what are those called? Neurodegenerative conditions. Now, I'm not saying that that's the sole cause of Alzheimer's or Parkinson's or anything else, but somebody's going to find a thread there. I mean, it's certainly not a jump. The breadcrumbs are pretty close together. Okay, and I don't have to prove that it is. Somebody else has to prove that it's not, and I'm okay with the fact if they prove that it's not. Because when they prove it's not, they solved it. And that's what we're all trying to do, is just solve it. So one of the things, especially in the upper cervical ligament injury, do not invalidate your role in the market with this condition. Doctors, on these podcasts, what I do is just try to take a topic and kind of riff on it. I've done a lot of episodes, and I'll continue to do a lot of episodes because I think there needs to be this condition, this area needs to have a voice, and that voice is my voice and the Smart Injury Doctor's voice. If you're interested in our program, go to our website, check us out, set up a time with me to find out about the program. We have lots of free resources that you can use to assist yourself with better understanding these injuries and these conditions. As always, I appreciate your time, your attention, and I look forward to giving you more content on the next podcast.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.